Joining us today, the Honourable Steve McNeil, Premier of the Province of Nova Scotia. Dr. Robert Strang, the Chief Medical Officer of Health for Nova Scotia. Dr. Carr, the CEO of the NSAHA. And Dr. Jangar, the CEO of the IWK Health Centre. Go ahead, Premier.
Thank you, Tina. I want to welcome, first of all, Dr. Carr and Dr. Jangard with us today. Thank you for the work that you and your teams are doing. And I'll ask Dr. Strang to give us an update on where COVID-19 stands in Nova Scotia today.
Thank you, Premier. So today we're announcing we've had 5 new cases of COVID-19 in the last 24 hours, bringing the total number of confirmed cases to 73. While most of the cases are travel-related or connected to earlier cases, one of the new cases cannot currently be linked to travel or an earlier case. The investigation to determine the exposure and whether others have been exposed is ongoing. At this point, public health cannot confirm that this case is linked to community spread. We do know that one of the situations we're looking at with this case was a significant number of people getting together on St. Patrick's Day. This case illustrates why it's so important that the things we have put in place, people adhere to them. It's the social distancing, why we've decreased the number in mass gatherings from 150 to 50, now down to 5. All the rules around self-isolation if you've traveled outside of the province. Those are so important because how this virus spread is when people get together in close contact. And if we can keep apart from each other, especially in significant numbers, that goes. It's such an important thing to minimize the chance of the virus to spread. We know that of all our 73 cases now, that the age range remains from below 10 to into the mid-70s. As yesterday, we still have 2 individuals. We now have 2 individuals who are currently being treated in hospital, and we have 2 cases, as I reported yesterday, that can be considered to be resolved. Overall, we've tested around roughly 3,200 Nova Scotians with negative tests, and plus the 73 are positive. I want to speak just briefly. There's been some in the media today around a case involving of an employee of Halifax Transit. I've been in conversation early this morning with the regional MOH about that case. Appropriate public health steps were taken in coordination with Halifax Transit. We know that the source of exposure was not involved, does not involve riding on a bus. So there's nothing at all about this case to suggest that it would represent a signal of an increased risk for the public or bus drivers by being on a bus. Appropriate steps are being taken by HRM within the workplace around this case. But I wanted to emphasize that taking the bus is an important activity a necessary activity in our community, and that this case does not reflect any change in the low level of risk and the importance of maintaining our buses as an essential public service. I want to talk a little bit also about expanding our testing. I think this is very good news, and I've been involved in a lot of discussions this morning about how hard our folks in the laboratory system and at 811 working very coordinated way with public health around making sure that we are rapidly expanding our testing. As I talked about yesterday, we are now testing anybody who needs to go be in one of our hospitals. And where it's appropriate to test them for COVID-19, we are testing them. We are testing any contacts of cases right away. We are now testing, increasing the number of people that are being tested at our assessment sites. Anybody that's been referred in by 811. We were previously doing some assessment and some people screened out, but we've made the decision now that anybody who is referred in by 811, the teletriage, we're going to test them, and we're looking at further opportunities in the very near future to continue to expand into testing in the community. We know that there's a possibility of community spread, and we need to be on top of that. My colleagues in the lab, Dr. Hatchett, Dr. LeBlanc, who are leading that work, have done tremendous work with their team that we have. As we continue to push them by increasing testing, we have the significant capacity in the lab to absorb that demand for increased testing by increasing the hours which the lab is working. They're looking at measures that they can even go 24/7 if necessary by adjusting their staffing model, bringing in another piece of equipment. We look to stand that up over time. So the combination of testing, rapidly moving into opportunities for testing in the community, and then the capacity we have in the lab to absorb that testing demand, I think is a very good news story.
Thank you, Dr. Strang, and for those working in the labs, and else pass on our great appreciation for their continued work. And it is a great news story when you look at the amount of expansion we're doing in and around testing and the availability and spread when we move out beyond just those that are traveling. I think it's reassuring Nova Scotians, and thank you. I'll ask Dr. Carr now to give us an update on what the Nova Scotia Health Authority is doing.
Thank you, Premier, and good afternoon, ladies and gentlemen. And yeah, I would just like to pick up on Dr. Strang's point. Just as we've seen our colleagues in the lab undertake an amazing effort to increase testing, we have seen that same discipline right across the health system. We've seen it in our acute care sites, we've seen it in community sites, we're seeing it in home and community care. And so I want to start by saying thank you to all of our staff and physicians, to everybody in our health system who have been working so aggressively over the last number of weeks to prepare for the coming surge. And that's everybody in the system. The Premier has acknowledged, the cleaners that are working in our hospitals. This is porters. This is everybody working to support the front lines. But it's equally all of our staff in finance, in materials management, in housekeeping, everywhere. In our emergency operations center, we have some administrative staff who would normally be working Monday to Friday 8 to 4, who I think have been for over 21 days, showing up and putting in excess of 12-hour days to support the efforts to prepare for this. So I just sincerely want to say thank you to everybody for their amazing work. I also want to say thanks to the people of Nova Scotia, first for listening to Dr. Strang and for doing everything we can collectively to slow down and stop the spread of this virus. I also just want to say a very sincere thank you for all of the very positive wishes that we've received. We've received many messages and other gestures. We're seeing it on social media where the good people of Nova Scotia are letting healthcare workers across the province know that their work is really valued, that they're supporting our healthcare workers, and that it's important. So I just really want to say thank you for that, because it means a lot to people. We have been, over the last couple of weeks, digging in and preparing ourselves for COVID. We have stood up our Emergency Operations Center, which is essentially a command structure that operates centrally from Halifax, but has sites within each of the regions across the province. It essentially operates on a 24/7 basis, and we are at the point where decisions are being made on an hourly basis that relate to information that's coming in about our services, about the virus, and about how it's impacting our population. There's been a lot of planning work done, and so just recently, as of today, we have 17 primary assessment sites operating in the province. And we have inpatient units established in 6 of our regional sites. Those inpatient units obviously will be looking after patients who are admitted with COVID, and some of those patients will need to go on to ICU. Just to give people a sense, we operate just over 2,000 acute inpatient beds across the province. We would typically, this time of the year with the flu season, be at or above 100% occupancy. We are currently at around 70% occupancy, and that has been the result of some of the difficult decisions that have made around reducing services and just our teams working really hard. We've been able to move some patients safely to other settings of care, and so we're standing at about 70%. In our ICUs, we have about 122 adult ICUs in the province, and we're operating at just below 50% occupancy. And so that just gives you a sense of where we're starting. Dr. Strang made reference to the fact that we're able to now test over 400 cases a day, and in fact yesterday the lab team completed over 474 tests. Now, and that, I think, a month ago probably would have been almost 2 weeks' work for the lab, and so their ability to make that kind of change truly is admirable. The Premier or the Minister of Health, I think a few days ago, mentioned that we've been advancing on a virtual care strategy in the province, and on Monday we announced to providers across the province that we would be building this capability in. As of today at noon, we've had over 2,000 requests from providers across the province, family doctors, specialists, nurse practitioners, nurses, occupational therapists. And as of noon today, we have 800 of those providers stood up and on the platform. And over the next couple of days, we will actually complete that work. And so that is, as we are going through this and having to make difficult decisions around changing some of our resources, it's important for people to know that we are fundamentally changing the way that we can deliver services and ensuring that we can continue to connect with our patients through virtual means. And I just also want to mention that in terms of mental health and addictions, we've also have a substantial effort going on to enhance our capacity for mental health and addictions, both for existing patients, but we also know the stresses of an event like this are creating a lot of anxiety and grief and other needs in the community, and so we want to be there to support people. And so we have a lot of virtual and other services that are being stood up for mental health patients. So our teams are working very hard to maintain our essential clinical services. We've made some very difficult decisions, as I mentioned, to reduce services, to limit access to our facilities, and really we're doing this to ensure that we can continue to provide care to our most vulnerable patients, to protect those patients and our staff members. We recognize that this is very challenging for family members that have patients in the hospital, and we're taking every one of these decisions with a very serious degree of consideration. We continue to plan at a system level, and that really means that our system is now adapting, and we are, as I mentioned, essentially responding in a minute-by-minute way to the changing systems overall. And that's going to mean that people are going to see changes in the system in the days ahead. We shouldn't be concerned about that. We have a plan that we're following, and we're going to continue to do that. So there are some examples of what we're doing. For instance, you might see us essentially moving patients and staff into different surgical centers so that we can consolidate surgery within centers. You might see us as well changing some of our emergency department configurations, changing some of our smaller emergency departments into more urgent care centers, supporting local primary care, while allowing us to redeploy the emergency staff to our regional sites. And so these are all the kinds of things that are going on, and they're important things that we need to be doing here. So I'll just end by saying that we know that this is going to get more intense in the weeks ahead, and we have a lot of work ahead of us. I just really want to reassure everybody that the staff and the physicians of the Nova Scotia Health system are doing everything they can to be prepared, and we will be here when people need our care. Thank you.
Thank you, Dr. Carr, and please pass on our thanks to your team. And now we'll have Dr. Jangard speak to us about the IWK.
Good afternoon, everyone. I would also like to start by thanking Nova Scotians for the very many of you who are following the directives, the health directives from Dr. Strang and the Premier. Your collective efforts to self-isolate, to maintain social and physical distancing are and will continue to have a significant impact to help slow the onset of the number of cases that we will need to be ready to take care of. We're very appreciative of the work that you're doing on our behalf to help us deal with this pandemic. And these measures are really necessary, as you've heard over and over again, to make sure our system is ready and able to care for those who may need us, those who do need to be coming to the hospital and are ill. I also would like to say a heartfelt thank you to all the dedicated staff, not only at the IWK, but across the system. The teamwork and steady commitment that we've had working together and in our own organizations is a commitment to our Nova Scotians, to patients and families. And it's inspirational to see how our teams are working together. We couldn't do what we do at the IWK for women, children, and families without the support of our programs, but also the rest of the province, working together as we navigate really what is unprecedented and challenging times. We must all do our part, and so thank you to the health system for doing their part and for Nova Scotians for doing their part. When I look at what's going on at the IWK as far as operational readiness, it's very similar to what you've heard Dr. Carr talk about at the IWK. We have made difficult decisions about reducing our care to urgent, emergent, and very time-sensitive care. And you heard me talk about pregnancy care before, but that's also cancer care and care for chronic conditions that needs to be seen. So there are people in our province who still need to have hospital care, even at a time where we need to be building capacity. Mental health is one of those areas, and our mental health group has worked largely to move to the virtual platform, and the other access they need for urgent and emergent services is continuing. It's really hard to update you on everything that's going on, probably, and as Dr. Carr said, it changes hour to hour and sometimes minute to minute. I would suggest that if people have questions about any of the changes that are going on at the IWK, you can visit our website. And if someone is experiencing a crisis for mental health where they need to have immediate assistance, the number is 1-888-429-8167. So please make sure that you care for yourself and others by using that line if you need to. We also are sending up our Zoom physicians, and we are looking at how can we use some of those or get at some of those urgent and outpatient clinic that don't need to come to the hospital done by distance. We will be not looking at some of our more elective appointments until a little later on when we see what the impact of the next few days to weeks will be. One of the things that we've had some questions about is now that the provincial borders are closed, what does that do to our maritime mandate? What about children and women who need to come for urgent services at the WK? Today, I can assure you that those services are still there. We are there for our patients in PEI, New Brunswick, and Newfoundland who need our services. We continue to work through how we get that expedited so you can get across the border easily, but we are here for the care that is required. Similar to the NSHA, it is really important for us to social distance and physical distance. So those who do not need to be in the building are working from home wherever possible. More difficult, however, has been those decisions about limiting the number of people that can come with our patients and family. Patients and family support is really, really important in the world of pediatric and maternity care, and it's been very, very difficult to say no visitors and only one support person and only some of the time. This is not only hard on our patients and families, it's very hard on our staff, for which this is something that is dear to their heart. We are working through it, and we know it's because it is important to keep people safe. And we thank the public, we thank our patients that have been in and for their patience. And like the NSHA, good to see on social media expressions of thank you for doing this for us. So thank you for all of the good wishes that are coming through with that. So the IWK's COVID-19 assessment and treatment and testing center is up and seeing patients through the 811 system. Our pandemic response unit is also operational. Our staff have been redeployed and trained to work in it, and we're ready. So as much as we can be, because we don't know, what tomorrow's going to look like, we're ready to take the care of the patients and the families that come to our services. Thank you.
Thank you, Dr. Jangard, and thank you to all of the staff at the IWK. Now we'll take questions.
Again, just a reminder, we will take one question and one follow-up from reporters. This is all media requests need to be related to COVID-19. Again, please mute your phones in order to hear those who have questions. It's important that all other phones are muted. We'll start today with Tim Bousquet. Go ahead, Tim.
Thank you. And I just want to ask the question I was trying to ask yesterday to the Premier on follow-up about rents, which will be due 6 days from now on April 1st. Some time ago, on March 19th, you ordered that no one be evicted because as a result of COVID-19. It was somewhat ambiguous, and I've been asking your staff and the provincial staff for a copy of that order, and it has not yet been published, so far as I know. So I'm curious about why it hasn't been published. And also, yesterday, Manitoba Premier Brian Pallister declared a freeze in rent, and as I understand it, that included long time notice, the 4-month notice for rent increases. Will you consider that?
Well, first of all, we made the order early on around no one would be evicted as it was related to COVID-19. We did not say there would be no evictions if there were other evictions that had been in place for other reasons. But if it's directly related to COVID-19, we would be involved. As you know, all of those would have to go to a hearing. And that's where the role we can play without putting a blanket order on evictions across our province. So we'll continue to work with our landlords, and I know some of them have actually expressed to their tenants to come to them if there's issues related to COVID-19, and they would work with them to find their way through this.
Do you have a follow-up, Tim?
Yeah, I guess I didn't hear about the rent freeze, but my follow-up would be to Dr. Strang, I guess. Your staff has been very helpful in communicating with me, and I appreciate that. I spoke with Jason LeBlanc Tuesday, and he said to me that it's not worth it, or it could be counterproductive to test asymptomatic people because you'll get a false negative. And I don't quite understand that, because I'm hearing reports all over the United States and elsewhere in the world that people who are asymptomatic are being tested. So could you clarify that for me?
Yeah, I had a conversation with Dr. LeBlanc on that. I mean, he and I are in agreement that we need to be testing people and looking for people who may be infected when they don't have any symptoms. I think what the clarification is that if somebody is in self-isolation for 14 days because of exposure, and we test them and they're negative, let's say on day 7, they still have to stick with that 14-day isolation period, because say they got a fever and cough, and on day 7 we test them and it's negative for COVID, or they have another respiratory virus. It doesn't mean that they could not still be incubating COVID and get sick with COVID illness on day 9 or 10. I think that was the point of clarification that Jason was trying to make with you, that a negative test when somebody's in that self-isolation period doesn't completely rule out that they may not come down with COVID, and they still need to stick with that 14-day isolation period.
Thanks, Tim. Again, just a reminder, put your phones on mute. We're hearing some background noise, so if you could put your phones on mute, that will make this go a lot easier. Next, we'll go to Cassandra Nadeau-Lamarche from Radio-Canada. Go ahead.
Yes, hi. So the New Brunswick government yesterday decided it was further restricting access to its borders. So peace officers are now allowed to refuse entrance into the province to non-essential travelers. So is that something that you are looking at that may be happening in the future here?
Well, we have, as you know, been at our border. First of all, we've been at our airport really for a couple of weeks, telling all travelers coming home they must isolate for 14 days. The beginning of this week, we locked down our borders, both at the land border and the 2 ferry terminals, one in Digby and one in North Sydney, and are telling all travelers, if you're coming home, you must go directly home and self-isolate. I think it's critical that people fully understand that. That is not stopping at the grocery store. That is not stopping at the post office. That is going directly home and isolating for 14 days. And what we've said, there is some commercial traffic that has direct access in and out of our province, truck drivers, medical professionals who are coming across the border who will be in essential service in that lane. But we've said to all others, if you're coming for social purposes, stay home. Stay in your own province, and let's work together to ensure, quite frankly, that we slow the spread of this virus.
Go ahead if you have a follow-up, Cassandra.
Yes. So seniors have been identified as some of the people that are most at risk to develop complications. So they have had for a lot of them to switch their schedules a lot and to isolate. But seniors tend to get very lonely, they get more lonely. So is the government taking steps to make sure those seniors that are stuck either in their homes or in senior homes have ways to occupy themselves during the quarantine?
Well, the Minister of Health is working with our partners when it comes to long-term care, those that are in long-term care facilities across the province, to look at what are the activities, what are the things that we can do inside, are there electronic devices that will allow them to connect with family outside. You are absolutely right, not only for seniors, but quite frankly for all of those who are self-isolating. We are worried about their mental health. That's why Dr. Strang spoke about it yesterday, and today both Dr. Carr and Dr. Jangar spoke about that directly. I can't stress this enough. If you are at home feeling isolated, pick up the phone, call somebody, but it's also incumbent on all of us. We know our neighbors. We know people who are at home alone. Pick up the phone and call them. Ask them how they're doing. If you know that someone is living alone, whether they're a senior or not, and they're single mom with 3 kids and they have to need groceries, if you're their neighbor, ask them, can you do it for them? Do the simple request of just checking in. It will go a long way because no one wants to feel like they're fighting this by themselves. Even though we're asking people to self-isolate, it doesn't mean that they can't communicate with people. And that's the biggest role that I think each of us plays. It's a caring, thoughtful, respectful role that each of us have to play in this. And it will allow us to find our way out of this, I think, in a much, much more positive way. Not only will we have fought the virus, but we will have found a new way to ensure that we provide a communication with inside of our collective communities.
Thanks, Cassandra. Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, thank you. I'd like to ask a question to our Premier, please. The Nova Scotia Veterinary Medical Association has asked the province to designate veterinary medicine as an essential service, just to ensure vets won't have to close in the future, which could result in animal suffering. We're wondering if the province has reached a decision on this.
I'll ask Dr. Strang to respond.
Yeah, thank you, Premier, and thanks for the question. We received that correspondence yesterday, and I've been working with the lawyers supporting me to amend the order under the Health Protection Act to add veterinarians to be able to provide urgent and emergent veterinary services for pets under this order.
Go ahead, Sharon, if you have a follow-up question.
Oh, thank you. Yes, I have another question for Dr. Strang, please. You have indicated we will possibly see community spread. If so, what would be the next step for the province if that was to occur? And people are wondering, if it does happen, if the area or areas of spread will be identified.
So a couple of questions there. So if we see community spread, I mean, the indication of that, if we start to get one or more cases where we cannot somehow link that back to them being in contact or them having traveled or being in contact with somebody who has traveled, we do expect to see that. We will. All that means is that we have to continue our efforts, and when we have a circumstance like that, public health would be very aggressively following up that individual, trying to understand where they might have been exposed. And as I said, now that we are anybody who's potentially been in close contact with that case, we would be attesting them right away to looking for people who may have very mild symptoms or even no symptoms that could be positive. So, and if we start to see that within a community, we're looking at ways we could then bring in aggressively bring in enhanced testing within that small community if there's indications of spread within the community, whether it's one part of HRM or whether it's one of our more rural communities. Knowing that from evidence around the world is that if you can aggressively move in to a community where you start to see community spread and start to rapidly enhance and expand the testing within that small geographic area. So if and when we got to that situation, we we would be communicating as appropriate to the public and people in that community about what exactly the details of what that testing opportunity would look like.
Thanks, Sharon. Next, we'll go to Jean Laroche, CBC. Go ahead, Jean.
Hi there. My first question is for the Premier, please. This has to do, obviously, with the ever-increasing number of people who are looking for help from your government. Seems you can't skip a day without somebody looking for some sort of compensation for their losses. But I'm curious, Premier, what should individuals and companies realistically expect from your government in terms of compensation for losses?
Well, we're looking at where the gaps may be with the announcement of the federal government. The federal government has made, obviously, with the availability of unemployment insurance now to more Canadians, more Nova Scotians. That's a positive thing. Hopefully, they'll quickly be able to turn that around without the waiting process. We believe there's some support from our end leading up to that. We're looking from on the business side of how do we deal with the issues of deferrals. We're hoping to hear something from the big banks when it comes to commercial deferral of commercial loans, which in turn then can be passed on to rents from some of our restaurant small business owners in the area. And we will put together a package, and we are in the final stages of putting together a package to be able to dovetail into what the federal government is doing to support, in essence, that. We will not certainly be able to make everybody whole, but what we're trying to do is to be able to give people the hope that not only will they be okay, that they'll find their way through this to be able to provide the necessities for their families, but at the same time, how even though this may be challenging on their business, there is a hope at the end of it, and that we want them to be in a position that when we see our way past the virus and we start seeing us getting control of it, that they will be ready to start providing economic hope and jobs back to those people that were working for them.
Go ahead, John, if you have a follow-up.
I do, and this will be for Doctors Carr and Jangard. I just wondered, you talked about being ready for a surge. I would like to hear your thoughts on what a surge looks like for each of your institutions. What are you planning for, and when do you expect that surge to happen?
Sure, thanks. Thank you, Jean. So, I mean, a surge looks like active cases in multiple settings across the province. As of today, we have currently 2 patients, and so we're prepared for that surge. But really, it would be seeing multiples of patients showing up in a hospital. Essentially, when we say that we're ready, we are ready for that initial surge. The fact is also, it's also true that depending upon how effective our primary strategies have been in terms of social distancing and trying to reduce the spread, we could see very quickly numbers of cases going up. And so we also have a plan that allows us to escalate and to increase the resources that we have available to treat this should that be required.
So thanks. So a surge for children, you've heard Dr. Strang say a number of times, and myself the last time I was here, looking at how this affects children, so children being 0 to the age 19 around the rest of the world, is that although they will get the virus and they will get sick with the virus, they tend to do so with much milder forms. However, some children still do get quite sick and do need to be admitted to the hospital. And so in the same kind of way that our partners in the rest of the province have looked, we have realigned to have a room open that we can have the COVID children cared for in the same area by a team. We're fortunate that it can be co-located next to our pediatric intensive care unit, so that there are some ways in which we can have our training for our staff be augmented by the regular daily work that we do. But the kind of care that we need to provide for both the pediatric and the adult population is the kind of care that we provide for other kinds of things. So it's supportive care, it's ventilatory care if needs be, and it is having the right folks that can actually do all of those kinds of things available. So surge is around having the capacity built to start. And then as we move forward, having the operations in the background and a plan that we can increase that, those numbers of beds, those numbers of people doing this in response to what happens. And those plans and that activity is some of the things that both Dr. Carr and I were talking about before.
Next, we'll go to Chris Halef from News 95.7. Go ahead, Chris.
Thank you very much. This question, it's for either Dr. Carr or Dr. Jangard, whoever would like to answer, but we're hearing from community members who are eager to sew masks, gowns, and other protective gear for frontline workers if there is a shortage of manufactured equipment. I'm just wondering where you guys stand on that.
Thank you very much. I'll start, and Dr. Jangard might want to jump in. But first of all, I want to appreciate the spirit behind that, and we very much appreciate everybody's desire to do whatever they can to support their fellow citizens in the healthcare system. Dr. Gail Tomlin-Murphy yesterday brought together a large group of community partners and innovators with ACOA and Volta. There's a number of local industries that I think the Premier has referred to who are all very interested in doing what they can do and to mobilize around this. And so our response would be we just want to do this in an organized way. What we don't want to do is have people spending time and energy doing something that they think will be helpful only to find out that that actually won't be helpful. And so we do need to have some level of coordination. There would need to be certain specifications and things like that we would need to meet. So we will have any of our information numbers would be if people want to reach out to us at any of our either at the province within the health authority, I'm sure at the IWK, we would be happy to direct people to the group that are looking after this, and we are appreciative of everybody's efforts.
I would echo the appreciation. We have had not only people who want to make new things, but we also have had a number of our other companies who work, some of our education systems, some of the universities reach out and say, hey, we do research, we have some of these things, are they helpful to you? Again, it's heartwarming to see that. We are trying to bring them all together and flow them through one single source so that we can make sure that we are doing this in a coordinated fashion. So.
Do you have a follow-up question?
No follow-up question. Thank you very much.
Great. Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Thank you. I'm looking for a point of clarification from Dr. Strang, if I could. You said in the news release and you said in the news conference here that although one of the new cases can't currently be linked to travel or an earlier case, there is this case of St. Patrick's Day. Are they linked? Or I guess what I'm asking is what's preventing you from saying that it's travel-related or connected to other earlier cases?
Simply because we haven't completed the investigation to be definitive on where the exposure that would explain this person's individual has occurred. Until we do that, we can't make definitive statements.
Go ahead, Keith, if you have a follow-up question.
Okay, yeah, it's related to the transit question. The unions have been asking that people on the bus be limited to essential service workers only while we go through this. Is that something you're considering, Dr. Strang or the Premier?
You want me to start? So we have not gotten to a point yet in Nova Scotia where we've said it's only essential service people who are working. We're as you've heard the Premier say, in my order, there's a lot of capacity for other businesses to run as long as they adhere to public health principles. While we need to prevent the spread of this virus, in an event like this, there's the second objective is always to try to minimize social disruption. So we need to find both of those and work our way through that. And for many people, buses are essential. So we've got to also be cognizant of it's not just about essential service workers, but there are people in our communities that buses are critical for them to function. Even when we're asking people to stay home, for some families, the only way they can get one person to get groceries or go to the pharmacy store is with the bus. So it's really important that we preserve our bus system as best and as long as we can, knowing that it's an essential part of functioning in our communities.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Hi there. Yes, this is for the Premier. You said when the feds rolled out their plan, you'd announce your plan for the province. We're hearing from small businesses that deferred rent isn't enough. The loss of revenue from this period of closure won't be coming back, whereas the landlords will eventually be paid in entirety for the lost income during this time. Will the government consider direct funding for small businesses, and when will this funding be rolled out?
We're looking at a number of policy initiatives that will be announced in the coming days. We're looking at how we best support individual companies to keep them in a position to be ready to start up immediately when we find our way through this. We're obviously concerned about the fact that when you look at commercial lending, if it's not deferred, many of these facilities just may not be here in 3 months if they're forced to, if they can't defer their rent. The reason why we're trying to have deferred rent is at least capital in their hands, leaves cash in their hands to be able to operate. If we drain their bank accounts in the first 60 days, there's nothing left. That's what we're trying to work towards, and some of that will be some direct funding and how we can best do that. But we need all of us to do our part, and that will require the Government of Canada. We as a province will do it, as well as the big banks need to play a portion of that, so we can give people some hope that they can see their way out of this.
Go ahead, Lindsay, if you have a follow-up question.
Yes, you said it'll be ready in the coming days. What's your message to businesses that are worrying about bills and rent and mortgage payments in just 6 days? What should they expect?
We understand. I was in their position. Before I did this job, I was self-employed. I ran my own business. I know exactly how they're feeling. This is a challenging time. But we want to make sure that the decisions that we make are impacting the most people and trying to keep our economy in a position of almost, as it described by one of my colleagues, almost freezing to the point where we hold people to where they are, and then as the thaw happens, when we find our way through this, they're ready to take off. That's our goal, to be able to work with all of them. And as you can appreciate, every one of these businesses are providing a different service inside of our economy, so how we deal with them isn't necessarily the same from one to the other. And looking at some of the programs, the national government has worked very hard at trying to make sure they get money into the pockets of individuals, making sure that whether it's EI changes, whether it is the direct payments for those who've lost their jobs over this period of time for the next number of months. It's not complete income replacement, but it's putting money in the hands of individual Canadians and Nova Scotians. And what we're working at and looking at, how can we best support the other side and say directly to those self-employed artists, those self-employed business owners, that we know we need to give you some support to help you weather this storm. So as the freeze thaws, you're in a position to start up right away. Our goal really is to have our economy set to go day one and work our way out of this. It's no good for us to wait and leave it and hope our economy starts up 6 months after we've started opening it up. That's what we're trying to do and work with. And our team at Business has been working with different organizations that represent many employers, many small business owners in the province, and we will indicate in the coming days what that will look like.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hello. I believe this will be a question for Dr. Strang. We've heard that there was possible COVID exposure in Amherst at the Cumberland Regional Hospital, and apparently the hospital there is moving all delivering mothers to Truro and neighboring hospitals. Wondering if you can confirm that is true, and if so, what would the impact look like?
I'm not aware of that circumstance. I don't know, Brendan, if you know any more about that.
I can speak to it. I certainly cannot confirm the presence of COVID. What we have been planning to take the women and children at the Women and Children's Unit at Cumberland. We have actually planned to take the inpatient Women and Children's Unit there, and as you said, temporarily transition care to Colchester, and That unit looks after probably currently about actively a couple hundred patients, 60 of whom would be from the province of New Brunswick. And so the intention there has been that we would actually temporarily shut down the birthing part of it, just because it's difficult to maintain that service, and those resources could be redeployed to the birthing unit at Colchester. That being said, there is family medicine presence in the community, nursing presence. There's an obstetrician there for any kind of emergencies, so this will be a temporary thing. One of our staff earlier today had some symptoms, vague symptoms, and so our occupational health in the fullness of compliance with kind of where we're trying to do said it would actually be safer for that person not to go to work today, and so we made the decision that we would actually shut the unit today as opposed to tomorrow as had been planned.
Natasha, go ahead if you have a follow-up question.
So I just want to be clear that you did not move delivering mothers to Truro and other neighboring hospitals from the Amherst Hospital because of possible COVID exposure. I just want to be absolutely clear on that.
That is correct.
Thanks for that question. Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. I guess this question would be for Dr. Strang. Here we are, day 12, and it sounds like it's a possible example of a community transmission case with this particular patient relating to St. Patrick's Day. And I guess I'm just wondering, from a public health investigation standpoint, how many close contacts are we understanding that were around this person? You mentioned yesterday that there's oftentimes 2 close contacts with patients today, but I'm wondering, in this situation, how many close contacts are there? And how do the public health investigators do their jobs in tracing the steps backwards? Are we using anything like cell phone data to really get a handle on where these people were?
So I'll answer your question first. We're aware that there was an event of, I don't know the exact number, but in the range of about 50 people at a social gathering on St. Patrick's Day. That is likely this is where our case was exposed to COVID-19. What we do, I know some folks are around the world are looking at that cell phone data. We're looking at that. We're not ready to use that yet. It's very much like detective work. The public health nurse talks to people, starting with the case, and we say, where were you during a certain time frame? What were you doing? Who were you in contact with? And then we approach it by layers, and then we reach out and talk to those contacts. So it's all about, and I used the term a number of days ago, it's shoe leather epidemiology. It is getting out, talking to people, understanding where they've been and who they've been in contact with, reaching out to that next layer of people, understanding the social interactions. And I said, what we're doing now is everybody who's defined as being in close contact with that individual, and their parameters that we use in public health for every disease of what defines a close contact. We are now with COVID, we are testing anybody who is a close contact where we're putting them in self-isolation, but we're not waiting to see if they get sick or not. We're testing them right away. And we're in the middle of that investigation on this case. And as I said earlier, we as much as possible, we work quietly to talk to contacts, make sure people are aware that they have been exposed and the appropriate steps are taken. But if we do need to do a public announcement, like we did a week or so ago around the basketball tournament, we will use that public announcement as a way to make sure people are aware and get them to come forward. But we only use that when our other methods of a more, I guess I call it a private approach, respecting people's confidentiality, won't get us to where we need to be.
Go ahead, Jesse, if you have a follow-up question.
Thank you very much. I appreciate that. I guess my last question would be, in the case of public health deeming sites like, for example, this Burnside garage or the CIBC building where there was a reported case of COVID-19 with a worker there, how do we know for sure that these places are now safe for people to go back in and do the work? I guess, how do we know that it's publicly safe?
So that's where we work with an employer or whoever the owner of the building is, whether it was a school or whoever. We identify who would be in who would in that work. Let's use the example of a work site. Who amongst that work site would have been in close contact? Because if it's a large building, not everybody's in close contact with the case. And then we also work with the employer about how everybody in that work site would be informed about what's going on and given appropriate information, and then also we'll give them guidance on the appropriate cleaning steps that need to happen. With COVID-19, there aren't outside of a healthcare setting, routine cleaning procedures and commonly available cleaning chemicals. Even 1 in 10 dilute bleach is sufficient. So it doesn't need sophisticated approaches. It's just thoroughness and using commonly available cleaning. So we'll give advice about appropriate cleaning steps as necessary if there has been a case of COVID within a work site or some other specific setting.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Yeah, I was actually going to ask about the Burnside transit garage situation. And the transit union wants the garage temporarily closed for the safety of other workers, but by the sounds of it, Dr. Strang, you don't think that step would be necessary?
In my discussion with the regional MOH this morning, they were very clear. They've identified who's been in close contact with the case within that work site. Appropriate steps have now been taken to self-isolate and test those close contacts. There hasn't been broad exposure within the workplace. We got to understand. We always go back to how is this disease spread. And using public health principles about who's at risk and who is not at risk. In this situation, there's no risk beyond already identified contacts within that work site. There's no need to close that work site.
Go ahead, John, if you have a follow-up.
Yeah, this is for Dr. Strang as well. And it's a question from a colleague. He's doing a story on the National Emergency Strategic Stockpile that includes personal protective equipment and ventilators. I believe a part of that stockpile is in Bedford. So have you made or expect to make a request to get material from that stockpile?
So we've been involved with, as I said earlier, our common procurement programs with our federal government. That emergency stockpile, we're well aware of that. The federal government uses it for specific emergencies. So it's more that is there if we had a specific event or some kind of issue within our hospitals that we had to rapidly deploy the materials and even there's even hospital beds and other things within that. It's almost like a pop-up hospital. So we're not going to turn to that now. We have other ways that we're using to shore up our supplies of personal protective equipment, but we're well aware of the presence of that federal capacity, and it's part of what we in our health system emergency management folks are always aware of that issue and the ability for us to turn to our federal colleagues if and when we need it.
Thank you very much. That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. We are now investigating whether we have a case of community spread. We don't know, and we have to allow the public health to do their job. Dr. Strang and his team will determine the route of this spread. Whatever they find, this is a wake-up call. Everyone needs to avoid social gathering. We've heard today from Dr. Carr and Dr. Jangard about how hard their employees are working to be ready if this gets out of control. Our hospital administrators, our doctors, our nurses, our cleaning staff, everyone is focused on containing the spread of COVID-19. But none of this matters. None of it matters. It's all for naught if we don't do our part, if you don't do your part by self-isolating. COVID-19 was passed on at a social gathering, and now we have to find out how far it has gone. I'm not trying to scare you. I'm actually trying to convince you. When we say stop gathering and stay home, we mean it. As Premier in mid-March, I usually like to look for the sun. I can't tell you how much I'm praying for a snowstorm or a thunderstorm this weekend. Hopefully that will keep you indoors. But if the sun shines this weekend and you feel the urge to go out, don't. Think of your loved ones, your neighbors, and if that's not enough, think how mad the good doctor and I are going to be on Monday if people continue to have social gatherings.